Okay, so in this discussion, we've got to talk about herd immunity, right? That's the big counter argument. We've got to protect those who cannot be vaccinated or those that are immunocompromised. So let's look how that really measures up. Let's look at 2014 and 2015. This is actually from California's Department of Health. And this is the actual stats from that measles outbreak, because that's always, as we've seen this year, that's the big kicker. That's what people tend to start getting up in arms about, measles. So if we look at the cases, there was, at the end of the day, when you look at all the data, there was a 31% vaccine failure rate, meaning that that percentage of individuals that got measles, it was because they had the vaccine and the vaccine did not work. Another thing that's not stated is that 53% of those individuals were adults, not children. And they actually removed choice from the parents of California after this outbreak, stating that, you know, because of this outbreak, parents could not send their children to school unless they had a medical exemption. And guess what they're trying to do now in California? Now they're trying to monitor the medical exemptions and monitor the doctors and control that through the state. So basically, they're limiting medical exemptions now too. Okay, and so this is what we need to do anytime that there is an outbreak, and an outbreak just simply means more cases than usual. So even if we've had 3 cases in Oklahoma, even if it's 3 cases in Oklahoma, we need to be looking at the genotypes of these measles cases. We need to be looking at what is the source of the measles. Is it from what they call an outbreak strain, or is it from the vaccine? Because again, about 30% in these outbreaks are coming from the vaccine strains. So the vaccines are not always working as they should be, and that's not something you'll ever hear talked about in the media. Okay, let's look at the mumps. Mumps is becoming more and more talked about for its ineffectiveness. Recently, there's a Navy warship that has been quarantined, 100% MMR vaccination rates, and many on that ship, they can't bring it into port because mumps is just running rampant on that ship. And they've all been vaccinated, so it was started by the vaccine. Okay, and then we're also seeing a resurgence of whooping cough. And there's some emerging science that is showing that the scientists are saying that the disease is back because we didn't really understand how the defenses against whooping cough worked. We didn't understand what needed to be done to prevent it. Instead, we layered assumptions upon assumptions, and now we find ourselves in a very uncomfortable position admitting that we may have made some crucial errors. This is definitely not where we thought we'd be in 2017. So this particular study was actually showing that the vaccine may cause you to become more susceptible to whooping cough throughout your life now. So science has never settled. I mean, we see over the years that sometimes we change our mind, even on vaccines.